You see this bill that I'm leaning up against here? This is the new bill. This is the Harry Reid, the distinguished majority leader's health bill. And we want to make sure the American people have a chance to read it, and that they have a chance to know exactly what it costs, and they have a chance to know exactly how it affects them. And that's not an unreasonable request, we don't think. That's the way the Senate works. That's our job. When it came to the defense authorization bill, we spent a couple of weeks doing that. When it came to No Child Left Behind, the education bill, we spent 7 weeks going through it. And they weren't 2,007 pages long. The Homeland Security bill took 7 weeks. The energy bill in 2002 took 8 weeks. A farm bill last year took 4 weeks. So we've got a little reading to do, a little work to do, and we've done some preliminary reading, but what we want to make sure is that the American people read the bill, know what it costs, and know how it affects them, because health care is a very personal matter. And I've done some reading since the bill came out last night. I was also a little bit amused to hear our friends complaining about how we're slowing things down. Well, this bill has been hidden in the majority leader's office for 6 weeks. He wouldn't let any of us read it. I don't know who he's been in there with writing it, but I guess it takes a long time to write a 2,007-page bill. But he didn't bring it out until last night, and now we've got it printed out, and now he wants to vote on Saturday. Well, that's all right with us. If he wants to vote on Saturday or Sunday or Monday or Thanksgiving Day, we're going to be here, because these are the most important set of votes that we're ever likely to take in this body, at least during the time I'm here. And let me give a preliminary report to the American people in the terms of the Thanksgiving spirit about this bill. It came out with a lot of fanfare. It's been hidden in the majority leader's office for 6 weeks. But here's my early verdict in terms of the Thanksgiving season. This is the same turkey that you saw in August, and it's not going to taste any better in November. It's not much different than what worried you in August. In fact, it's gotten a little bit worse. Let me give you, if I may, just a few thoughts about the bill. Why would I say it's the same turkey that you saw in August and that you didn't like in August? Well, it's still going to have higher premiums for you to pay. It's still going to have higher taxes for you to pay. There's still going to be big Medicare cuts for seniors to absorb in their program. And while it's a little too early to tell, there's very likely to be more federal debt. It's still a big bill, more than 2,000 pages, and if you wait until it's fully implemented, it's still somewhere between $2 and $3 trillion over a 10-year period of time. The Republican Budget Committee staff has looked it over carefully since last night and says it's about $2.5 trillion in spending over 10 years. And it still starts taxing you and cutting your benefits if you're on Medicare immediately, but the benefits that come to you, for the most part, don't start until 2014.